This is One-on-One. Norma Gindes is Executive Director of the Bergen Volunteer Medical Initiative. Good to see you, Norma.
Great to be here. Thanks so much for having us.
I want to thank our friend Elaine Adler, who introduced us to great people like yourself. I want to thank Elaine for that. Listen, tell us what the Bergen Volunteer Medical Initiative is. You're a very important initiative that provides important health care for people who otherwise wouldn't get it.
Absolutely. The mission of the Bergen Volunteer...
By the way, your site will be up. Please put the site up. You're a nonprofit throughout the program because you don't make any money out of this, right?
No.
Go.
Okay. The mission of the Bergen Volunteer Medical Initiative is to provide free preventive and primary health care to low-income working adults who have no health insurance and can't afford to pay for it. So we're talking about people, folks who fall between 100 and 200% of the federal poverty guideline. So that means they make a little bit too much to qualify for federally funded programs like Medicaid, but they don't really have much money to buy health insurance. So, you know, you look at a family of four who's making between $20,000 and $40,000.
Right.
And if you live in Bergen County, a lot of that is going to rent and food and other basic necessities. You really can't afford to pay $15,000 a year to insure somebody, which is just about what it costs if you're buying the insurance yourself.
Norma, how do people find you?
They find us mostly through word of mouth, although we certainly have done a tremendous amount of outreach. We have a website. We had posters that went out through the community. We're in touch with all of the nonprofits that have a population that would fall into our criteria. So, but once people come and they see the kind of care they are getting, because our motto is the culture of caring.
Right.
And that means we spend a lot of time with patients. There's a lot of respect. They tell their friends and their neighbors, and then they come down.
Mm-hmm. You have a connection with the Horizon Foundation.
We do. We have a wonderful Horizon Foundation for New Jersey has been incredibly generous and very supportive of us.
Same here.
from the beginning.
Very big on helping in terms of healthcare causes, particularly for folks who have a hard time getting access to important healthcare.
They do. They're very interested in going to the grassroots community organizations because I think they realize that we have the ability to make an impact on a level that sometimes very large healthcare centers can't.
Sure, give us an example of that, particularly because I know the diabetes piece is a big part of this, so go ahead.
Well, they've given us money since we opened our healthcare center in 2009, but particularly in the last year, we have gotten a grant to establish a diabetes education program.
A diabetes education
program. And
why? Why diabetes?
Well, if you look at the population that come to our health center, about 50% of our patients are Hispanic. And within the Hispanic population, they have a much higher percentage of people with diabetes than you find in the rest of the population. So a lot of our patients have diabetes. It takes education to really manage diabetes well. It's not just about, here, go fill this prescription and take this medication. You really have to know how to manage the medication. Nutrition is essential. A good nutrition is essential. Exercise and all kinds of other medical things, foot care and eye care and things of that nature.
It's so funny, Norma, because people say, oh, it's a diabetes program, but the reality is diabetes, if not dealt with, will translate into a whole range of other serious medical and health problems.
Well, you know, type 2 diabetes in the United States is rampant, and it's a very big problem for the population at large, for the whole country. So I think what Horizon saw in us was the ability to change people's lives one patient at a time to really make an impact. So the diabetes educator meets with the patient one-on-one after they see the doctor and goes over the medication. Then we'll call them every week to get their A1C numbers, which is the measure of their glucose sugar, and also talk to them about exercise and what are they eating and looking at their diets. So say they're a Latino and they have a certain kind of diet, but to be able to go look through that diet and say, well, how can we change this a little bit to make it more, less carbohydrates, a little bit more diabetic. Right,
You know what I like about that? And by the way, we're putting up the website of the Bergen Volunteer Medical Initiative. You know what I really like about that? Sometimes people will say, we impact 14,000 or 18,000 people, and that's great. Numbers are terrific. But isn't it great when you talk about we impacted, we changed this one person's life? I mean, I love when people are caught up in numbers, because sometimes they think numbers will get you more money as a nonprofit, because I guess some foundations and corporations are impressed by that. But I like the idea that you talked about one person, doing it one at a time.
It's interesting that you say that, Steve, because everyone who walks through our door is an individual who gets treated with a lot of respect.
Sure.
And look, we see 800 patients a year and about 6,000 medical visits, so it's not like we don't have any volume.
Right.
However, each person is really important, and we're providing...
They're not a number.
They're not a number, and we're providing a medical home for them. Now, these are folks
without... A medical home?
A medical home. So that means we are now their health care provider. And if they need any x-rays or any kind of diagnostic...
Excuse me, regardless of their financial situation?
Oh, no, they've got to fit into our financial criteria.
No. Meaning they don't have to have they've got to fit into the financial situation, but it's not like they don't what I'm trying to get at is, it's not that they get denied because they don't have enough money.
Correct.
That's what I want to be clear on.
Correct. So now we work with the 5 Bergen County hospitals who have been incredibly generous and cooperating with us, and they provide for our patients free diagnostic tests, so that's mammograms, x-rays.
Right.
We work with Quest Diagnostics that provides all of our laboratory tests for free. We work with BD that has provided us with lots of corporate support and all kinds of supplies.
Excuse me, doesn't this reduce hospital emergency room
Well,
visits?
that's the whole concept. The concept is if you take care of people and you provide primary care for the uninsured, you are going to reduce the number of people coming to the emergency room.
Why is that important?
Well, first of all, the emergency room today has become the primary care office for a lot of people without insurance. And who's paying for that? You're paying for it, and I'm paying for it in our own insurance policies.
It costs more than your place? Does it cost more in the ER than in your place?
I think it costs about $1,600 in the ER to see a patient, and it certainly doesn't cost that much in our healthcare center to see a patient. Not only that, the patient comes in, we treat them, we identify certain chronic illnesses, they come back in a month.
That's their home.
That is
the
their
ER is not your healthcare home.
Right. We're not a one-stop. We are a consistent healthcare center that provides very good care. And I don't want to leave without mentioning...
Real quick, got a minute left.
All of the medical care is provided by volunteer nurses, doctors, and nurse practitioners.
Get out of here.
No.
Who are these heroes and heroines?
These are retired folks. These are folks who really care about what's happening in the world, and they care about people who have no insurance.
They don't get enough attention.
They don't. We definitely need more attention on that.
See, that's why Elaine Adler at the Adler Aphasia
That's right.
Center. That's why when Elaine calls and she says, hey, you need to cover so-and-so, it's always a good person doing something really important as part of our initiative that we call Making a Difference, right?
Right.
And you are making a difference. Norma, I want to thank you, the Executive Director of the Bergen Volunteer Medical Initiative, done with volunteers and others. You're doing important work. Congratulations. Keep it up.
Thanks. Thanks so much for having us.
That's great.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Robert Wood Johnson Foundation, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. PSE&G, committed to improving New Jersey's economy and strengthening its communities. And by the law firm of Gibbons PC. Promotional support provided by NJ Biz, all business, all New Jersey. And by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.